Well, a warning from doctors tonight as cases of COVID-19 are rising once again, doggone it. They say it's mostly because of 3 new subvariants with the so-called Delta mutation. That's a lot to unpack. So News 4's Austin Brissett is live in studio to break it all down for us. Austin?
Well, Kevin, it appears more people are testing positive because of that particular strain's very high contagiousness. And at the same time, doctors are saying even if you tested positive for Omicron during that wave last year and into this year, that natural protection doesn't work as well with the new subvariants.
We've seen about a 50% increase in cases of COVID-19 in Oklahoma over the past 2 weeks.
And 3 new COVID-19 subvariants sweeping across the Sooner State and the entire region are to blame.
But our region of the country, 75% of the new cases are due to one of those 3 subvariants.
Dr. Dale Bratzler says a mutation from the Delta variant that we saw in the summer of 2021 is now a part of the Omicron subvariant. And right now, studies are showing it to be 25 to 27% more contagious than the original Omicron variant and is spreading quickly with some resistance to natural immunity.
But they picked up mutations from the Delta variant, and that's made them partially resistant, at least, to the natural immunity you got if you had Omicron in December and January.
Overall, the rolling 7-day average of new cases sits at about 484, up about 149 cases since around May 24th, with the state's top health professionals saying Oklahoma's mortality rate from COVID hasn't gone down.
Oklahoma is among the top 10 states with the highest mortality rate from COVID.
And doctors are making another plea with COVID-19 not entirely gone.
There's something to be said about moving on, but at the same time, if we completely ignore it, if we don't pay attention, then it's when you forget about public health.
Vaccination is definitely much more effective than natural infection preventing hospitalization and death.
Well, Dr. Bratzler says while hospitalizations have risen a little in the state, he says the good news is they're not seeing the subvariant send very many people to the hospital. And he also says we're not close to a surge like we've seen in the past.